My name's Daniel Sheehan, and I'm a dermatologist. I was born in Augusta, Georgia, and I grew up in Columbia County. My grandmother on my father's side actually died of melanoma, and my father had a melanoma as well. Fortunately, my dad's melanoma was caught at a very early stage. Because of my family's strong history of skin cancer, I grew up going to the dermatologist frequently, so dermatology is a specialty that I've really sort of been exposed to since I was very, very young. About a year ago, Dr. Chen and I opened this practice that's really tailored towards both general dermatology and dermatologic surgery. In particular, I enjoy doing this procedure called Mohs surgery, which is a technique that we use for getting rid of skin cancers, particularly skin cancers on the head and neck. The Mohs surgery technique involves removing a small amount of tissue at a time and looking at it very carefully under the microscope while the patient waits in the office to try to ensure that the cancer is completely removed.
He's very laid back and friendly and kind and pays very close attention to you. Things can develop rapidly if you're not paying attention, and I had one place on my right hand earlier that had to have some surgeries.
I'd recommend Dr. Sheehan because of his mannerisms, how he handles patients. He tells us what's going on. From the time you walk in and sit down, he explains everything to you.
He has an incredible education.
My background in dermatology and dermatopathology really allow me to provide a very high level of care for patients with skin cancer. When patients leave, I want them to feel like they understand why we've done what we've done. And if we've prescribed medicines, I want them to feel like they know what the medicine's for, and I want them to feel like they know how to use it. And that's basically the kind of level of care that I would want for me or my family member in a medical setting, and that's kind of the way I try to approach things. I feel like if I'm providing people that kind of care, I sleep well at night knowing that we're doing a good job taking care of patients. I want to give our dermatology patients the absolute highest level of care that we can provide them.